Hi, this is Carolyn Parrish, and I'm going to talk to you on nursing conflict management. Conflict is defined by Merriam-Webster Dictionary as a mental struggle resulting from incompatible or opposing needs, drives, or external or internal demands. Defined as a strong disagreement between people groups, this strong disagreement most often leads in an argument. Looking at the key elements from that definition, you have a disagreement where two or more parties are involved. There is a mental struggle, and there are opposing interests on each side. We are looking at conflict in nursing because conflict can be between two nurses or a nurse and another healthcare provider, which can lead to job stress and dissatisfaction. In general, nurses work in high stress environments and can experience nurse burnout as a result. Conflict in the workplace can lead to injury and violence. Billions of dollars have been spent on direct medical care and productivity losses to the workforce. Typically, nurses receive little training in conflict management. In healthcare, sources of conflict can result from limited time and resources due to staff shortages. Nurses are working longer hours with heavier workloads. This can add to working in a stressful environment. Also, differing goals and work styles, cultural diversity among colleagues and patients are factors because it affects communication and being able to understand another's point of view. Disparities in knowledge and power can lead to conflict due to a lack of understanding between younger and older nurses. Some younger nurses feel ignored and unappreciated due to a lack of experience. This results in the beliefs of nurses eating their young. Looking at how a person responds to conflict depends on the situation. Culture can be a factor. For an example, in Asian culture, Asian women will avoid conflict and will be more accommodating. With gender differences, males tend to be more assertive in a conflict, whereas most women avoid it. In a profession dominated by females, research has shown that some nurses tend to withdraw from a conflict situation instead of confronting it. In resolving a conflict, some people reflect on previous experience and on knowledge of the situation. In looking at conflict, you need to focus on other responses and how a conflict can affect you emotionally, physically, and cognitively. Emotional responses range from feelings of fear and anger to feelings of a perceived threat. This affects our physical responses where we have rapid heartbeat, shallow breathing, tension throughout the body. We show signs of extreme stress. Our cognitive responses reflect to our inner voice telling us how to deal with a conflict. The Thomas Kilmann model looks at 5 strategies in managing conflict. All strategies deal with the relationship between assertiveness and cooperativeness as expressed on the chart. The first strategy is known as competing, a win-lose situation, meaning that I win at all costs. This is high assertiveness and low cooperativeness. This is generally seen as a negative approach to resolving conflict. However, in an emergency situation, this can be used when a quick, decisive action is vital. The second strategy is accommodating, a lose-win situation where I lose to preserve harmony in the relationship. This tactic is used when someone yields for the greater good. Using this tactic can be viewed as good and bad. It may be beneficial to use this to build a relationship at all costs. However, this can be viewed as a sign of ignorance or weakness. The third strategy is avoiding, where there are no winners or losers. This tactic is mostly seen in nursing as a way to prevent potential damage resulting from a confrontation with the other party. Nurses who avoid conflict at all costs are not viewed as leaders of the profession because the conflict is not going to go away. The fourth strategy is compromising, viewed as a win some, lose some, or a bargaining process where each party is willing to give up something to gain leverage on the other. This is viewed as being in the middle in terms of assertiveness and cooperativeness, where concessions are made. This tactic is useful for a quick fix or temporary solution to a complex issue. However, it is important not to use too many concessions to keep people happy. It is important to resolve the conflict. The final strategy is collaborating, viewed as a win-win situation. It is a process that involves high assertiveness and high cooperativeness. The strategy involves creating a mutual solution to meet a common goal. This is generally considered the most effective strategy in managing conflict. No matter what strategy is used in managing conflict, there are some factors to keep in mind. First, it is important to maintain open communication between both parties. It is important for both sides to listen and talk to each other. Both sides need to work together to create a plan to solve the problem. This is important in nursing because working in a healthcare environment is stressful and demanding, and nurses should work on a common goal to maintain patient safety at all costs.